Okay, welcome back to the Stop Feeling Like Shit podcast. And today we're going to be talking about why listen to this podcast. And so, Dr. Buzz, I want you to tell us what makes wellness, anti-aging different than healthcare, and why do we choose health wellness?
So there's a huge difference between, I think a better way to phrase that is probably what's the difference between, what we're doing or wellness compared to traditional medical care.
Yeah.
Okay. So, and there's a huge, huge difference. So traditional medical care in the U.S. is amazing, but traditional medical care has nothing to do with your health. Traditional medical care focuses on handling crises. So if you get shot, if you have a car accident and break your leg, if you have a heart attack, the healthcare in the United States is amazing because those are crisis situations, and we have the best hospitals and the best doctors for that.
Right.
But if you're looking for what your traditional doctor's going to tell you to do for your health, I think that you're in for a rough ride. Mm-hmm. You know what I'm saying? So, and that doesn't mean they're bad, but they can't be all things to all people. But traditional health care, what your insurance covers in the United States, has nothing to do with health. It has to do with crisis care. And a lot of people ask me, is wellness care covered by insurance? And the answer is most of the time it's not, because all insurance works the same way. So, the analogy I like to use with people is, let me ask you a question, Danielle. If your car had bald tires, would your auto insurance buy you new tires?
No, but I wish.
Yeah, that'd be great, but it doesn't, because it's not an emergency, right? That's a maintenance item. So maintenance items are your responsibility. Your healthcare is the same way. So your healthcare doesn't pay for your gym membership, doesn't pay for your supplements, it doesn't pay for a lot of the procedures that we do, but it doesn't mean that that these procedures aren't important. So the question I always ask people is, if you want your insurance to cover it, you have to wait till it's critical in nature, or you want to handle it ahead of time until it's a crisis, catastrophic, correct? Because health insurance does cover catastrophic things, but it doesn't cover maintenance things.
Right.
So, do you want to live your life going from catastrophic event to catastrophic event, or do you want to take care of your health so you don't have the catastrophic events?
Right. And once you hit the catastrophic.
And catastrophic is like, you want to wait till you have to replace the knee, you want to avoid the knee replacement.
Right.
You want to wait till you have diabetes, or you want to handle it before you have diabetes.
Mm-hmm. And most people, I think, too, they wait and they wait and they wait until something does happen. And then they want it to be reversed in, a week or a month.
Well, that's the purpose of the podcast. I think a lot of people don't know there is an alternative.
Yeah.
You know what I'm saying? So they don't realize that, I think a lot of people, just like when I was growing up, think if your insurance doesn't cover it, then it must not be real or good, or it would be covered. So I'll just wait until something happens. But, I think dentists have done a really good job in the United States. You don't, in dental care in the U.S., people get their teeth cleaned every so often because they know that if they don't maintain their teeth, you're just going there for root canals, and no one likes to get root canals. But people don't do that with their regular health.
Yeah.
So, a good example would be, someone that has knee pain, because, knee pain is something that we see a ton of, and a lot of people will develop knee pain over time. So what happens if someone starts to develop knee pain or knee arthritis is you go to the doctor, you say your knee hurts, and, usually they'll start with some over-the-counter medication. We'll take some Tylenol or Advil or ibuprofen or something like that and see how it goes. And once again, that's not doing anything to fix the knee pain. If anything, it's going to speed the arthritic process up, because all those NSAIDs, which are non-steroidal anti-inflammatory drugs, all work on this pathway called the COX-2 pathway, which, although it does decrease pain, it also decreases cartilage production. So if you're taking an NSAID and you have arthritis, you're speeding the arthritic process up.
Yeah, a lot of people don't know that.
Yeah, they don't know that. So when that doesn't work, which it never will, then you go back and they'll say, okay, well, we'll give you a cortisone shot or a corticosteroid shot. Well, those shots cause so much damage that you're only allowed to get 3 per joint per year. And if you would get 4, that's medical malpractice. Because every time you do that cortisone shot, you lose up to 7% bone loss and cartilage loss every shot. So if you get your 3 per year, that's 21% loss on top of the damage already there.
Yeah, and we have people that call us that say, oh, I just, I'm calling because I have knee pain or this pain or whatever. And they say, oh, I just got a cortisone shot. And I'm like, oh, no.
Yeah. So, with the other downside to the cortisone shot, or, or an epidural or all these type of things is, when you get those, we can't even do any regenerative stuff for 6 weeks afterwards, because if we would follow up and do like a PRP or A2M or like an allograft, umbilical cord tissue, that cortisone kind of kills everything in the joint anyway, so it's a waste of time. So we can't even touch you for 6 weeks, which is kind of crazy, right? That's how much destruction.
Yeah.
So when that doesn't work, because it never works out, then sometimes people, if we go down the traditional medical model, they'll say, okay, well then we'll do hyaluronic acid injections, which those are made out of I don't know if most people probably know those. That's made out of if you look at a rooster, like the neck of a rooster, like that red thing that hangs down, that's made out of that, which is kind of crazy, right?
That's
so they'll do those injections, and those never work because it's synthetic hyaluronic acid. It's not even the same hyaluronic acid you have in your joint. Remember, anything synthetic doesn't last. So that might buy you a month or a couple of months, but it isn't going to work out. And then after that, you're relegated. Well, we're going to wait to do surgery and replace the knee. And obviously, the knee God gave you is always going to be better than an artificial one.
Yes.
And just because your insurance covers it doesn't mean it's the right choice. And I'm 100% sure that anyone that has osteoarthritis or degenerative joint disease, if caught early enough, can avoid having a knee replacement surgery or shoulder replacement surgery or back surgery. I'm 100% sure, because we know with regenerative medicine, we can literally stop the cause of arthritis and reverse it. Okay. But most people don't know that.
Right.
And if you just go to your regular doctor and go down what we'll call the traditional medical pathway, you're going to end up with a back surgery, shoulder replacement surgery, knee replacement surgery. Like the outcomes aren't good because they're not trained on this regenerative stuff in school. So we're kind of like the Pied Pipers out there, training providers. Probably the biggest part of at Buckeye, we see a lot of patients here in Columbus. We have an affiliate clinic in Miami that they're doing amazing work, but that's just a small subset of people. So really, to reach more people, we're out there talking to providers every single day, trying to get them doing the exact same stuff we're doing, so we can have more of an influence.
Yeah.
Because there's no reason for someone with arthritis don't stop the arthritis. And that goes for lots of other things too. There's how many people out there are misdiagnosed with depression when they have hormonal issues, or how many people out there don't feel good and can't lose weight because their microbiome is messed up.
Yeah.
So there's all these different things that, our bodies are amazing, and our bodies always have the ability to heal itself, but you got to figure out what the hell, what's causing that problem and quit feeling like shit, right?
Yeah. Yeah. No,
So,
I agree.
So that's the big difference. And once again, this is not a knock on traditional medicine, because traditional medicine, if something's catastrophic, is the best here in the U.S.
Right.
But it has nothing to do with health. And everyone has to understand that. And you also have to understand, just because your insurance does or doesn't cover anything has nothing to do with it. That's the right choice.
Yeah.
That's very, very important.
Yeah. And so what's the difference between health span versus lifespan?
Yeah, that's something that gets tossed around a lot, and I think that's a great thing. And your lifespan is how long you live. So the average person in the U.S. now, although that just went down, it's been going up every generation, but that's a whole other conversation. But for the first time in a long time, the lifespan actually just decreased in the United States. But that's just how long you live. It has nothing to do with the quality of your life. And unfortunately, we both just went through. We had the death of a family member, so we've been spending a lot of time in the hospital. And it's kind of sad that that's the way a lot of people end up at the end.
Yeah, it is.
That's not the way that anyone wants to end up, but unfortunately, that's the way a lot of people do end up. And I dare to say that it doesn't have to be that way for a lot of people. So where your health span is how long you're healthy for. So the question was, that's great if you live to be 80, but if you have bad arthritis in your knees or back pain, or you're depressed and on SSRIs, and you feel like shit for the last 20 years of your life, is that what you want?
Yeah, I'm looking for quality.
Yeah, where your health span is how long you're healthy for. And I think it's crazy. People, we work our whole lives to retire.
Yeah.
But how many people retire with their health?
Yeah, not very many.
Yeah, so what we focus on is your health span, because our goal is for you to be, totally healthy in your 70s, 80s, even 90s. There's no reason you can't be.
Yeah, I mean,
right?
I see your mom. She's going on 80 years old, and you would never know. Yeah. She's running around like she's 60, 50, My grandma was the same way.
Yeah, so there's no reason age. So let's let's not even talk about age, because age doesn't matter.
Correct.
You might need a little more maintenance as you get older. You might need to, get an A2M injection, be on hormones. I don't know. Everyone's different, obviously. So it requires maintenance, but if you're willing to put in the work, there's no reason you can't be, 60, 70, 80, even 90s in doing what you want to do. And that's the main thing, doing what you want to do, not be, stuck at home feeling like garbage.
Yeah. And what do you think maybe for people when you say put in the work? Like what work are they doing?
I always tell patients, if you're not, you have to keep moving for starters. As soon as you quit moving, your health goes down. I don't care. Like, it just is what it is. The body was designed to move. So that doesn't mean you have to weight train. That's what we do. We enjoy it. But that definitely, whether it's pickleball, walking your dog, like, you got to move every day. And I think it's a good idea, set a goal, 45 minutes, an hour a day, do something where you're moving, whatever that may be. You got to take care of what you put in your body. You can't, drink alcohol every day, eat fast food every day, eat sweets every day. Like, long term, that's not sustainable. Yeah. And as we get older, our bodies become less tolerant of these activities. So, just because, you could drink 5 days a week when you're in your 20s, you're not gonna be able to do that when you're in your 50s and 60s.
Right.
You know what I'm saying? Or all these different things. So it does require some level of maintenance, but it's not hard.
No.
You know what I'm saying? So, make sure you're eating the proper foods, make sure you're taking some supplementation.
Yeah.
If your hormones are decreased, get your hormones back to where they're supposed to be. And if something doesn't feel right, get it checked out. But the key thing you have to ask yourself is, make sure what you're doing to fix the problem isn't masking the problem. So if you go to your doctor and you have heartburn and he says, "Oh, just take Prilosec," that's not fixing the damn problem.
Right.
That's decreasing stomach acid. So let's get it straight. So you have upset stomach or heartburn because you have too much acid. So let's just take a pill to decrease the acid. Well, when you decrease the acid, now you're not going to digest your food. So now you're going to be more likely to get colon cancer or stomach cancer. The answer is yes. So why not figure out if maybe you have an H. pylori infection. That's why you have upset stomach. Yeah. Or maybe you have some type of dysbiosis. Some of your microbiome's messed up because you took a bunch of antibiotics. Now, that's not covered by traditional insurance.
Right. And what do you think, some people might say, well, I don't have money to be dumping into my health. What do you think it costs a year, really, for what we're talking about?
I think realistically, if you have to budget, like a minimum $100 or $200 a month for your health, right? I mean, that's less than a car payment, way less than a house payment. And what's more important than your body? Right. It's not going to be free. But if you look at the things you do in your life that maybe aren't conducive to your health, that you spend more money on, how much do you spend on drinking? How much do you spend on cigarettes? How much do you spend on eating fast food?
Starbucks.
Yeah, Starbucks. Like this is all affordable for the majority of people. Yeah. It doesn't cost a lot to eat proper. Right. It doesn't cost a lot to not, and more importantly, to not do the bad stuff.
Yeah. Yeah. I always tell people, if you're getting good sleep, because sleep's very important, if you can get some sunlight, if you can take a walk, if you can't go to the gym, if you can do at-home exercises, whatever you can do, and if you can just eat healthy and drink water and take some supplements. And I know that what's so funny is actually when I met you, I didn't take really one supplement or vitamin. So you got me on the vitamin supplement train. And I will say that I do like taking them. They make me feel good. So I'll say those are very important.
Yeah, and you don't need a bunch of supplements. I don't want people to think we're taking 900 pills a day, but right. Just like everything else, there's a test called an organic acid test. In this test, if someone does it once a year, it tells you specifically what supplements you need. Because obviously the supplements I take are going to be different from what you would take, different from anyone else. So there's no such thing as everyone needs the same supplements. What do you have going on in your life? Are you on statins? If you're on statins, you have to take CoQ10. If you should even be on statins, which is a separate conversation. But if you're on statins and don't take CoQ10, you're going to feel terrible. Period. Yeah. If your triglycerides are high, take fish oil. You know what I'm saying? But get tested, get your blood work done, see what you specifically need for your health, and take those things. Because I also feel strongly that you can't have too much of a good thing too.
Yeah.
So I don't believe in taking supplements or vitamins if you don't need them. Only take what you really need, but get tested.
Yeah.
And those tests are out there and
never
available.
lie.
100%.
So yeah, that's what we're here for.
So, but going back to the health span, lifespan thing, who wants to live to be 60, 70, 80 and not be able to enjoy yourself?
Yeah.
That's kind of where I'm at. So, my goal is for all of my patients and all the people that I've influence over to have them be in their, in great shape and enjoying their lives and be happy and feel really good about themselves and most importantly, doing whatever they want to do for as long as they want to do it and never have the physical limitations of your health. And that's, it's 2023, almost 2024. That technology's there.
It is, yeah.
So there's no excuses now. We know how to do it. It's readily available. It's affordable for everybody. So there's really the only excuse you have is that you just don't want to do it.
Yeah.
And I would also really advise people, don't wait until it's too late. So don't wait until you're in a hospital bed, like messed up or going for a knee replacement or back surgery. Handle things ahead of time. Don't wait for the root canal. Get your teeth cleaned, and if you have a little cavity, get the thing filled, right?
Right.
The same thing. And, if you have something bothering you, whether it's knee pain, upset stomach, you're getting headaches, like get checked out by someone a functional medicine doctor or someone, that has the same mindset that we do. What's causing the problem and how can I get my body to heal itself?
Yeah.
That's the way you want to do it.
A lot of, I think a couple of my friends, I talk to, they think it's normal to always feel bloated or have chronic pain or inflammation. And so that's not normal, right?
No. Well, a lot of people, weight loss is a really, that we're going to do a whole episode on that. But I'll tell you right now, there's certain people out there that their microbiome, and when I say your microbiome, what we're talking about is we're talking from your mouth to your anus. Mm-hmm. What people don't realize, 90% of the cells of your body are in basically in that GI system from your mouth to your anus. They control your hormone system. They control your brain chemistry. Your gut is directly related and connected to your brain. A lot of people that can't lose weight, and we all know people like that, is because their microbiome is messed up. They're not digesting food properly. They can't lose weight.
Right.
So even though they're not eating anything, like there's people that will come in that say they eat one meal a day and they're still overweight. Well, if your microbiome is messed up, you're not going to lose weight.
Right. You can take all the diet things in the world.
Yeah. So, anyone that has difficulty losing weight, get your microbiome tested out. And what, how's my microbiome get messed up? Well, every time you take antibiotics kill good bugs and bad bugs. Mm-hmm. So, if you've taken a bunch of antibiotics in your life, or even one time, you could have killed off some of the good bugs that help digest food. So now when you digest food, it doesn't digest properly because you don't have the proper bugs, and then the body turns it into fat.
Yeah. So
you're doomed for failure. So once again, these are all things that the tests don't lie. You do the test. You do a DNA stool analysis. If you have like an H. pylori infection, or you're missing some good bacteria, those are all things we can replace.
Yeah.
Very easy.
Right.
So, and once again, that's what you're going to come back to. That the technology is there now.
Yeah.
So it's amazing. We just want more people to be aware of it because most people don't know that's even a thing. Right? I'm big boned or I've never lost weight. Well, no, because you can't lose weight.
Yeah.
And I don't care how much you starve yourself or how much you exercise, you won't lose the weight unless you fix the microbiome.
Mm-hmm. Yeah.
So.
Okay.
So I think the main thing here, going back to why should someone, why should you listen to this podcast, is just to understand that, if you or someone you care about is suffering with something, whether it's, difficulty losing weight, pain somewhere, depression, all of these things are manifestations. Our bodies are perfect until we mess them up. How do we mess them up? Eating bad foods, taking the wrong medications, we get injured, different things. But the beauty is the body can heal itself if we give it what it needs. And we're really going to focus on this podcast, talking with guests we're going to have come in here and other leaders in these fields of what can we do to make our bodies heal better so we don't have to suffer and we can have this health span we just talked about. Because the goal for everyone to listen to this is to be, 70, 80, 90 years old, doing whatever the heck you want to do, not feeling like shit.
Yeah.
And not taking a bunch of medications and not being in the hospital. Like I said, we spent the past couple of weeks in the hospital seeing these people, and people are in bad shape. and no one has to, no one wants to go out that way. So our goal is to really, not only help our patients, but to help providers realize there are alternatives out there and just really expose them to the technology that's out there. Yeah. So I'm super excited about, spreading the word, basically.
Yeah, me too.
So I guess we'll catch up next time.
Yeah. See you then.